for everybody for joining this morning. I'm glad for the opportunity to share a little bit about what my colleagues and I have been doing. So there's been a handful of us that have been doing research in the cognitive aging and Alzheimer's disease space for a few years, and we decided to pool resources, band together, and try and support others as well through this initiative, the Delaware Center for Cognitive Aging Research, which became official only a few months ago. So I probably don't need to tell this group very much about the burden of Alzheimer's disease in societies all over the world, but also in the United States and Delaware especially. So here are the data from 2019 and 2020 showing Alzheimer's disease as one of the leading causes of death in the United States. If you look at trends over time too, like over a decade or so, it's one of the only conditions that isn't going down as a leading cause of death. Whereas heart disease and cancer are slowly going down, Alzheimer's disease is not. And in fact, as the baby boomer generation ages through the age band at which they're at greatest risk, we're actually going to be seeing a very large increase in the prevalence of Alzheimer's disease. In Delaware alone, there are an estimated 19,000 people with Alzheimer's disease, which is not just an issue for them, but of course for their care partners and for the healthcare system, where it's one of the leading sources of leading sources of expenditures for Medicare. So at the same time that there's this incredible footprint of Alzheimer's disease in the world, there's also better evidence coming out all the time that many cases may be modifiable. So this was an article from 2020 showing that about 40% of cases are potentially modifiable, and as more risk factors are identified and studied, it's probably even more than that. So for example, I draw your attention to hearing loss, for example, in midlife. Right? If you can mitigate hearing loss with hearing aids, this risk actually goes down. So this isn't just a correlation, this actually is a causative relationship between hearing loss and incident dementia. A lot of the really exciting research that's happening in the Alzheimer's space happens through NIH-funded Alzheimer's Disease Research Centers, or ADRCs. And there are a number of these centers in the country, certainly not in every state. And even if it's in a person's state, it doesn't mean that a person can get to the center or can participate in the trial for a variety of reasons. And this is a real shame because, in the absence of a cure or really even disease-modifying agents, one of the things that clients really want to do and their families want to do is participate in cutting-edge research to try experimental approaches, but the access to that is poor. My colleagues and I at different institutions in Delaware have been doing research in this space in cognitive aging and Alzheimer's disease, and formed this center to support our own research, but also support the research of other people at institutions in Delaware and the surrounding areas to increase the infrastructure for Alzheimer's research, but also to increase access to cutting-edge research for Delawareans. We've been finding that a lot of older adults don't, even if they are able to, travel to, trials at Hopkins or Penn or wherever, they often don't want to or they aren't able to. And so we think it's important to have research infrastructure here. So the center is not just for research, but also for education and clinical training in Alzheimer's disease and related disorders. I can talk about that more if there's interest. Chris Martens is the director of our center. He's a physiologist and studies cerebrovasculature and how changes in cerebrovasculature contribute to normal and abnormal cognitive aging processes. I'm a neuropsychologist and study how we can use telehealth to identify people earlier, to get them into trials earlier, and to use telehealth technology to reach people better. Curtis Johnson is a biomedical engineer and MR physicist who studies MR elastography and other neuroimaging modalities. Alyssa Lanzi is a speech-language pathologist and studies cognitive rehabilitation. And Jim Ellison is a geriatric psychiatrist who runs the Swank Center for Memory Care and Geriatric Consultation. And then we're also partnering with other researchers to support their efforts. So we're trying to facilitate translational research for dementia prevention. That's sort of our end goal is, early identification, early intervention. So we're at least not now doing, trials of people with, moderate or severe dementia. We're trying to focus on people with risk factors or early signs of Alzheimer's disease. We're educating people in the community about brain health and aging and Alzheimer's disease and providing free memory screens. In fact, an initiative led by Dr. Ellison called Memory Ambassadors has led to about over 1,100 Delawareans being educated and screened about cognitive health and Alzheimer's disease. And one way that we're also training the next generation of clinicians is I bring master's students with me to actually do these screenings. So they get the experience working with older adults, providing some education and doing some screening. And then for those who are interested, we offer to connect them with the research arm of the center to do an intake and bring them into a registry that we're building. So this is probably currently the main way we're helping other researchers as well, as we're building a registry, a trial-ready cohort of older adults with memory loss, probably early signs of Alzheimer's disease, so that each person doesn't have to do their own recruiting individually. We're still building, we're still very new, but our goal is to have these core resources available for others. So I mentioned the participant registry, provide a cognitive assessment core that I would lead, teaching investigators and their students and whomever else how to do the assessments they want to do for their study and how to interpret the results that come from it. Clinical training and community engagement. We're very committed to clinical training, but also building a diverse registry of people so that our registry matches the demographics of Delaware. So we're doing a lot of really intentional outreach to minoritized communities to improve our diversity. We offer and are hoping to offer even more consultation on study design, particularly for issues that are specific to Alzheimer's disease or a condition that's going to worsen over time and that has really high attrition. We have 4 active studies right now. One is to determine the effect of a nutritional supplement called nicotinamide or nicotinamide riboside on cerebrovascular health and cognitive function in older adults with mild cognitive impairment, which for many people is an early manifestation of Alzheimer's disease. A second study is determining the effects of aerobic exercise on brain mechanics as assessed by MRI. A third is looking at what's called compensatory cognitive rehabilitation to improve functional independence in everyday life for older adults at risk for Alzheimer's disease. And a fourth study is looking about how mild cognitive impairment is associated with the ability to learn new gait patterns. I think my time is just about up, so I'll just conclude with a couple resources and ways to connect with us. So we have this website. This is our center's kind of general email line that will get to the right person. If you want to email me specifically, there's my email address. My name is Matt. And then if you're interested in the topic, we also published a couple articles a year ago in an issue of the Delaware Journal of Public Health about the center and about the state of Alzheimer's disease and dementia in Delaware, if you'd like to check that out.